Hey everyone, and welcome to another episode of Talking with Tangible. This month, we had the pleasure of speaking with Dr. Jason Jedlicka and covered topics related to dry eye and practice insights. For a full in-depth look at our interview, be sure to check out our accompanying blog post at tangiblescience.com.
Well, hi, welcome to Talking with Tangible. Today we have Dr. Jason Jedlicka with us, a man who really needs no introduction. How are you doing today, Dr. Jedlicka?
I'm doing great. How are you?
Doing well, doing well. So you're back to work, I assume?
I am back to work on a somewhat limited basis still, but it's good to be in the clinic and back to seeing patients again. Feels
Yeah.
good.
Does it
Yeah.
look a little different for you in terms of like your patient flow and the types of patients you're seeing, or is that just sort of business as usual?
Oh no, it definitely looks different. I mean, obviously it looks different because there's green X's all over the floor of the clinic for spacing, and everybody's masked and everything. But beyond that, we've been at it now for about 3 weeks, and the first couple of weeks we were definitely running less than 50% capacity as we're trying to figure out the dynamics of how crowded it's going to be, and is it going to be an issue if you've got 4 people checking in for an appointment all at the same time, for example.
Mhm.
But we've definitely gotten accustomed to some of the changes, and now we're up to running about 75%, and just starting to feel a bit more normal again. You know, masks notwithstanding.
Of course. So
Yeah.
have you missed traveling to conferences and speaking engagements and stuff this year?
Yeah, I mean, of course, they're always fun, and sometimes traveling gets to be a little bit exhausting, or you always want to get back home after a stretch of trips. But at this point, I would look forward to seeing my friends who I typically don't get to see, but at conferences. And so that part of it I miss is probably just as much the social interaction and the networking that comes with conferences than anything else. And so I think the teleconferencing that we're doing more of these days, it's just not quite the same. It's still fun, but it'd be fun to get back on to a conference, hopefully sometime in the near future.
Yeah, I'm looking forward to that as well. So diving into our just brief discussion today, I wanted to ask you a couple questions about
Sure.
how to use tangible hydropeg and particularly with dry eye patients. So just talking about scleral lenses, which have become such a valuable therapy for dry eye patients, but introducing an inherently hydrophobic lens to the eye kind of creates its own challenges. You would agree with that?
Absolutely.
Okay, so what's your go-to for surface treatments to try and manage that?
Well, so if I can just backtrack a tiny bit, and this is me on my soapbox, so cut me off if you need to. But we use scleral lenses to alleviate the symptoms of ocular surface disease for patients. We use scleral lenses to improve the visual quality of for patients with ocular surface disease in some cases. We use scleral lenses to heal the ocular surface of those patients with ocular surface disease in many cases, but we don't actually cure anything. We don't actually fix the dry eye disease, that underlying dry eye disease, for example, whether it's severe MGD or aqueous deficiency or any other type of inflammatory ocular surface disease. We don't really fix that. We don't make that part better. We're just making the eye healthier underneath the lens. And so, from that perspective, we still have all of the same issues to deal with. And then you add to that the fact that we're putting this lens on the eye. It's propping the lids open wider, which we know that because it's been studied. And I just had a patient in last night, for example, who wears a scleral in one eye only, and just sitting there looking at him, it was apparent to me as a observer who's astute at looking at eyes all day that the eye with scleral lens was open wider than the other eye. And so there's no question that we increase the surface area of the eye that's exposed to evaporative influences by putting on a scleral. There's no question that the upper lid, the lid wiper, the lower lid wiper blinking across a plastic surface as opposed to the eye surface itself is a negative. When you think about the vault of the lens, the thickness of the lens, and the lids blinking across that, it's pushing the lids out. So the actual lid wiper is tighter, if you will, as it closes across that lens than it would have been over the eye itself. And so the fact is, again, that we haven't really fixed the dry eye, the dry disease. We're treating the signs and symptoms of it. We're helping the patient have a better life, and we're keeping the cornea healthier in many ways, but we're not actually dealing with the underlying problem so much. And then on top of that, we're actually making the underlying problem kind of worse in some ways by taxing what little tears there are there in all the ways we just explained. So, putting a scleral on the eye of an ocular surface disease patient is a godsend for many people, and it's life-changing, but it's not without its drawbacks as well. And so when we use that scleral lens on those folks, some of the pitfalls are, again, the lens surface not wetting, the lens surface drying. And so the wonderful benefit of putting that lens on that patient's eye whose ocular surface disease has rendered their vision decreased because of it, because their cornea is so beat up. Now they're fighting visual fluctuations from the lens surface not staying wetted right. And that dry ocular surface, the dry lens surface, is just, multiple times more vulnerable to buildup. The proteins, the mucus, all of the things that are in the tear layer, all the negative things that accumulate on a lens over time are going to hit that scleral lens much harder in the area where the eye is open between blinks. And so, again, this is a whole other issue. And the breakdown of the lid wiper, you see it if you ever actually stain with lissamine and look at the lid wiper on patients who've been in scleral lenses for some time. It definitely breaks down the lid wiper. And so how do we combat that surface non-wetting, that surface variability, the buildup of debris on the lens surface from not having enough liquid there to wash it away, and the breakdown of the lid wiper over time from the friction between those lids and that lens surface. And the only way to do that, of course, is to somehow provide a barrier to friction and drying and buildup on that surface of the lens. And that is exactly what HydraPEG does. It deals with all of the problems that we face with the lens surface for that OSD patient.
That was a wonderful explanation of all of that. Thank you for that, first of all. And that you gave me sort of a perfect segue into the follow-up to that question, which was, just given that HydraPEG was designed to improve that interaction between the ocular surface and the lens material, how do you feel that translates to improving the vision quality in general and specifically in these dry eye patients?
Yeah, I think that it's a 95% win for folks. And there's always going to be that odd patient that has some awareness of their vision that they had with the lens surface. And these usually aren't your dry patients. They might be your cone patients or other patients or just your corneal GP wearers who actually feel that maybe the HydraPEG coating gives them some other alteration of their vision that they don't like, but that's so rare. And the majority of patients, once they've worn the lens for a day or two and they see how much more consistent the vision is, that they don't see that evaporation between blinks, the fogging that comes with the surface of the lens drying. It provides a more consistent visual acuity, and that's really the point. I think any scleral lens wearer is going to have good vision with or without a coating on the lens immediately after the blink or after application. But it's that when the lens been on for a few hours and they're getting that drying and the coating is keeping that lens from drying out and the vision is staying consistent. I think that's really the big benefit, is the consistency of the vision over the course of the wearing schedule.
Do you happen to have like a favorite HydraPEG patient or story?
Gosh, I have many, but if I can go back to your initial question, I recognize I didn't quite answer it completely.
Sure.
And I was going to say, you asked a little bit about using it and how we would use it. And I would say that in many ways, it would be easy enough to use this on every single patient. But in a lot of situations, I don't initially, because most of the time when we order scleral lenses, we're going to do a remake in the first couple weeks to fine tune the fit or prescription. And what I actually kind of like to do in many cases is I won't order it on the first lens unless the patient obviously needs it. But for a lot of my patients, I won't put it on the first lens, but then as they come back for their follow-up and we're looking at reordering, we'll talk about adding it to their lens because we'll already start to elicit some of the issues with lens surface. And so then on our reorder, many times we'll reorder it with our first remake with the HydraPeg on it, and then the patient is able to then evaluate and see the difference that it's made. And then again, almost universally, we don't end up taking it off again because they prefer it with it on. But it gives us that opportunity to kind of put it to the test, the lens without it, and let them see the benefits of the scleral lens, but also some of the drawbacks that can occur. And then when we go back and redo their lens and put it on the second lens, they can tell, wow, this lens is a lot more comfortable. It feels much more comfortable when I blink and things like that. So just wanted to follow up with that and kind of the strategy for how we implement it. But then, sorry, go ahead and repeat your other question. I'm off on tangents.
That's okay. No, that actually brings up another little thing that, sometimes I get asked if adding HydraPeg to a lens will change the fit. And based on what you just told me, it sounds like you don't really run into that. You're okay to order it on reorders and remakes rather than on the original order.
Yeah, I think with sclerals, I don't think it changes the fit. I think you could make a case for like a corneal gas perm where it might, and I've thought that it could, and I've actually ordered it for patients hoping it might. Maybe, again, making the lens surface a little slicker and allowing it to slip for that patient who's got too much lid control, maybe. But I've found that even in those cases, it really doesn't. It really just doesn't change the fit. So from that perspective, I think you can add it to current wearers without worrying that it's going to change anything at all, other than, again, just that surface wettability.
Yeah. Well, the question that we can come back to was if you had a favorite tangible HydraPeg story or patient. So now that you've had a minute to think about it.
Yeah, well, so let's talk about somebody recently. And this is really an interesting case because I had a patient who I've seen for a few years now, a young lady, probably late 20s, early 30s, keratoconus, and in scleral lenses now for maybe going on 3 or 4 years. And she had come in for an office visit right before everything kind of ground to a halt from the COVID. And she came in with a not for a regular appointment, but for an office visit with a chief complaint that she had blood in the corner of her eye when she was wearing her lens a few days prior. And her eye, that eye had been kind of bothering her. She felt dry. It felt a little bit irritable. And then again, just she noticed some blood in the corner of her eye. She took her lens out that night and noticed she thought a little bit of blood inside her lens. So of course, she comes in wearing her lenses and we look and the surface is definitely dry. I mean, there's no question. She blinks and within a second or two, you can see the surface drying. And her lenses at this point are probably 2 years old. So they're not brand new, but regardless, again, we stay in the eye, we stay in the lids, we look with lissamine and fluorescein at the lids and we evert the lids and look at the lid wiper. And this eye, this was her right eye, I believe, literally 4+ lid wiper epitheliopathy with a very clear area just near the center but slightly nasal where you could tell that lid had probably broken down and literally bled from the lid wiper zone, within the last few days. Her other eye, which asymptomatic, no issues at all, barely 1+ lid wiper epitheliopathy. So of course, we look at every other aspect of her fit. The fit is great. There's no other issues with that lens at all other than the surface. So we reordered her the exact same lens, but just put HydroPeg on that lens and sent it to her. And I'll grant that it was a new lens on top of it, but I just saw her back, well, the very first week after we started seeing patients in clinic again, to kind of follow up. It had been a couple of months now. We had mailed her lens, and she came back and had no issues with the comfort now, no issues with the bleeding, and looking at her lid margin, looking at her lid wiper with the lissamine, she still definitely had some lid wiper epitheliopathy, but it was probably 50% better than it had been with the old lens. So, again, I fully believe that having the HydroPeg there is what's really making the difference, even more than the new lens, because the new lens surface alone, while it would be, there wouldn't be scratches per se, or her old lens didn't look particularly built up. So again, I think that the added lubricity of having that layer over the lens and allowing that lid wiper to blink over it without the friction is what made all the difference.
Wow, that's a great story. Okay, so we're going to end with one last question. I always try to make this a little bit fun. So for you, the question is, what is your favorite era of music and your favorite band from that era?
Favorite era of music? Well, you probably know that I'm a big 80s fan. So, and among 80s music, you have to love the old new wave music, the alternative era beginnings. At the same time, I would say that if I'm going to pick something to listen to, I would probably choose my favorite new alternative music over my 80s, although it depends on the mood I'm in. So I probably like decade 2000 to 2010s alternative music. And of course, my favorite bands are going to be Snow Patrol, Death Cab for Cutie. Yeah. And among the old bands, gosh, I don't know. I could certainly listen to a playlist of old 80s new wave music like Echo and the Bunnymen and the Psychedelic Furs and who was I just thinking of that slipped my mind? Yaz, bands like that. It's good stuff. I like the old music, Brian Ferry, stuff like that. So
music, yeah. I have a lot of that on my playlist too. So that was a great answer. Well, thanks for being with us today. I really appreciate your time and your support of Tangible HydroPeg. And I hope that things in your clinic continue to take off all the way back to a normal feeling, normal setting. And again, thank you for everything you're doing for the eye care community.
You're welcome, and thank you for inviting me to be a part of it. It's always good to chat about great products with good people.